Nephrotic syndrome is a kidney disorder that causes the body to excrete too much protein in the urine. This condition can affect anyone but is more common in children and can significantly impact kidney function and overall health. This guide provides a comprehensive overview of nephrotic syndrome, detailing its causes, symptoms, and available treatment options. What is nephrotic syndrome? Nephrotic syndrome results from damage to the clusters of small blood vessels in the kidneys that filter waste and excess water from the blood. It is characterized by high levels of protein in the urine, low levels of protein in the blood, high cholesterol levels, and swelling, edema, particularly in the ankles and feet. Causes of nephrotic syndrome. The exact cause of nephrotic syndrome varies. In children, it is often caused by minimal change disease, which can be treated. In adults, it may be linked to other conditions such as diabetes, lupus, and infections. Some possible causes include autoimmune diseases, infections like HIV, hepatitis B and C, use of certain drugs, chronic conditions such as diabetes and lupus. Symptoms of nephrotic syndrome. Common symptoms include severe swelling, edema, particularly around the eyes and in the ankles and feet. Foamy urine, which may be caused by excess protein in the urine. Weight gain due to fluid retention. Fatigue. Loss of appetite. Diagnosing nephrotic syndrome. Diagnosis typically involves a series of tests including urine tests to check for protein, blood tests to assess kidney function and levels of cholesterol and proteins, kidney ultrasound or biopsy to determine the underlying cause. Treatment options. Treatment for nephrotic syndrome focuses on addressing the underlying cause, reducing symptoms, and preventing complications. Treatment options include corticosteroids and immunosuppressants to control the immune system, diuretics to relieve swelling, ACE inhibitors to reduce protein loss in urine, statins to manage cholesterol levels, modifications in diet, such as reducing salt intake to minimize edema. Managing and living with nephrotic syndrome. Living with nephrotic syndrome requires careful management of diet, lifestyle, and health. Regular checkups are crucial to monitor health and adjust treatments as necessary. Additionally, patients may need to make dietary changes, such as reducing salt and fat intake, to manage symptoms and improve kidney function. Conclusion. Nephrotic syndrome is a serious condition that requires careful medical management. With proper treatment and lifestyle adjustments, individuals with this condition can manage their symptoms and lead healthy lives. If you or someone you know exhibits symptoms of nephrotic syndrome, it's important to consult a healthcare provider for an accurate diagnosis and appropriate treatment plan.